My anesthetic had worn off. I'm feeling every bit of pain. I was slowly drifting away. The room was getting dark. The nurse came running out. We think he's not going to make it. Growing up, I was just always an active, cocky kid. I was a professional junior tennis player. I played throughout the world. I wanted to go abroad to specialize with tennis. But my dad's a doctor, my sister's also a physician. And I decided to just stay home and do my medical career here. I love running in little communities. It's nice seeing people in their daily activities. You see a lot of kids playing around, hand-me-down soccer balls. They just think this is life, you know? But it's very raw, it's very real, and I don't think Durban exists on a facade at all. I come from a family of runners, so I was training for my first marathon at the end of medical school. I had sharp shooting chest pain, and I lost 30 pounds. I was diagnosed with multi-drug resistant TB.
The advice that I was getting from people who claimed to be TB experts suggested that we do a lobectomy straight away. The lobe that's infected, cut it out. And we said no. We were going to try and salvage it.
I just thought, oh, it was another thing to do. We'll just take my 6 months of treatment and I'll be fine. I took 23 tablets a day with IV medication in my heart. The side effects were getting worse. I got depression, nausea and vomiting and feeling like you're about to faint almost every day. My skin started going into these big blisters, bursting with pus. I also had severe joint stiffness. Your joints lock up. Just to pee, it took me about 30 minutes to reach the bathroom.
We spent nights sitting in that lounge there, mulling over all the possibilities, basically wondering whether he was really going to get better, and listening to all the stories of success rather than failure. And then that's what gave us hope.
After 3 years, 1 week, 1 day, I was cured. The majority of people think that TB only hits a certain grouping of people, very poverty-stricken, living in overcrowded areas. 1/3 of the world today is infected with TB. As doctors and medical students, you're exposed to a big volume of sick patients. So if someone is collapsed on the floor, their job is to resuscitate them and bring them back to life. The doctor doesn't care about where the gloves are, where the masks are, where the aprons are. They're neglecting their own personal lives to help another person. Day to day, this is what a healthcare worker does. Go on, sir. Keep on. Go on, sir. That's why you're crying. Your chest is so bad. In here. Out. Good. In. It's a very small infection. It's not bad, right? And I don't think it's not TB or anything. The doctors are sure it's not TB. This is a global health problem. It's not a problem that's specific to South Africa. Until we learn to empathize, we're not going to develop the best tools, the best vaccines. We have to look at how we're going to protect future generations to come. And we need healthcare workers to protect themselves. A vaccine would be the answer.
மகள் சுசிலா 2 வருஷம் டிபி நோயினால் எதிர்த்து போராடி சிரமப்பட்டுச்சு. என் மகள் நிறைய ட்ரீட்மெண்ட் எடுத்து கூட மக சுகம் பெறத்துக்கு வழி இல்லை.
Sushila was a staff nurse, worked in our department. She was diagnosed as having tuberculosis. She was taking treatment. After about a month, she was still having fever and not feeling much better. It came to be known that she was not just multi-drug resistant, but she was extensively drug resistant, what is called XDR. For 2 years, we nursed her with every resource that was available, every drug available. We watched her slowly die.
அதுதான் இது நான் எடுக்கிறதே இல்லை. இந்த போட்டோவெல்லாம் 7-8 வருஷம் ஆச்சு இந்த பொட்டி எடுத்து. இன்றைக்கி தான் பார்க்குறேன். நான் எடுக்கிறதே இல்லை. அந்த பொட்டியை நான் தொடர்றதே இல்லை. பார்த்து வந்துச்சுமா. இதுதான் இங்கே வீட்டான எடுத்தது கேமரா. அது வெள்ளை போட சொல்லிச்சு மேலே. அதுக்கு தான் அது எடுக்கிறதே இல்லை. நான் அந்த போட்டோவெல்லாம் பார்த்துட்டு ரொம்ப கஷ்டமாகி போகுது.
When Sushila was lost, the morale of the team, especially the nursing team, was at its lowest. The loss was too close to their hearts that quite a few wanted to be moved out of that ward.
போன ஒரு முறை படிக்கும்போது அது எனக்கு இங்கே வந்ததுமே எனக்கு மனசுக்கு ஒரு கவலையாக இருந்துச்சு. இங்கே கூப்பிட்டா வெளியே அனுப்புனாங்க பேசுறதுக்கு.
அங்கே இருந்தால் நம்ம இது வந்திருக்க முடியாதுன்னு
சொல்ல முடியாது.
யாருக்குமே வரலாம்
எங்கே இருந்தாலே அது.
The loss of Sushila had repercussions in the institution. People were asking if they were susceptible to TB as Sushila was, and in fact the answer to that had to be yes, we all are susceptible to tuberculosis. So all nurses working in these high risk wards were provided with personal protection and put together various mechanisms to reduce the spread of tuberculosis within the hospital.
வயசுல இந்த நோய் பட வந்தது தேமல். அப்புறம் விரல் எடுத்ததும் காலில் கொஞ்சம் புண்ணு வந்துடுது, பெரிய விரல்ல. இந்த நாள் வரைக்கும் எனக்கு உடம்புக்கு மருந்துக்கு மாத்திரைலாம் கொடுத்து இந்த நோயை குணப்படுத்தி சுசிலா பேங்க் வேலைக்கு தான் போகணுன்னு ஆசைப்பட்டுச்சு. மேலே நம்பிக்கை வச்சு செய்யுமான்னு சொல்லி அனுப்புனதுன்னா நான் தான்.
We are still nowhere near controlling tuberculosis as a problem. 2% of our staff may develop disease every year. TB vaccine is perhaps the most promising tool towards TB control.
நைட்டு 12 மணிக்கெல்லாம் உன் பொண்ணுக்கு உயிர் பிரியும் அப்படின்னு சொல்லிட்டு போனாங்க. அப்பவே எனக்கு வேலை தாங்க முடியல.
I had doors slammed in my face when I mentioned the word TB. Even the healthcare workers would not be very keen to work in a TB treatment project because of the stigma. We select our health workers from the communities they are going to serve. Most of Operation Asha's health workers are women from disadvantaged backgrounds, and they are our foot soldiers. They are the ones in the front lines of the war against TB.
Yes, everybody. देखिए आपको टीबी है, आपको पता है? डॉक्टर ने आपको बताया टीबी है आपको। हाँ देखिए आपको पूरे 6 महीने का कोर्स है। 6 महीने के कोर्स में आपको एक दिन भी आपको मिस नहीं करना है डोज।
Our health workers sit in the community waiting for patients to come. Every 2 minutes, one patient dies of TB in our country. In public hospitals, for one doctor, there are hundreds of patients waiting in the outpatients department. So patients continue to suffer because of the lack of manpower. So the TB health workers are actually working as educators as well. They're like family for the patients. TB treatment is a terrible thing for a patient. The amount of suffering is unimaginable.
दवाई को हमेशा खाना है, खाने पीने का ध्यान रखना है। घबराना नहीं है, कोई भी दिक्कत होती है तो तुम्हें अलग से दवाई बुखार है तो बुखार की दवाई मिलेगी। धीरे से मुंह में रखिए आराम से। 8 महीने का होता है, इसमें इंजेक्शन भी लगाना पड़ता है। ठीक है, इंजेक्शन जो कुछ लगाना, अगर वो भी बिगड़ जाता है MDR कोई बोलेगा तो भी तो वो मुझे बताना। ठीक है, पूरी खा लोगी, तोड़ना है इसको। मारोगे
Healthcare workers across the world are suffering because TB has staged a comeback in the countries from where it had been eradicated. There is no effective vaccine for TB. There are 9 million cases in the world, and we are working towards a common goal, TB eradication. So we need new vaccines, we need delivery channels, we need to replicate best practices. We've eradicated smallpox, we've got rid of polio, we can do TB now.
TB doesn't get the recognition that it needs to in the United States. When I was in medical school, it was always something that was not top priority. It was always on the bottom of the list. Our attending physician would ask, "What do you think this patient has?" TB was always last. I knew after I got my master's in public health that I wanted to do some global health work. My first job was working on a project with multi-drug resistant TB in Swaziland. That training basically shaped what I have become now. There are almost 9 million people in New York City. It's a microcosm of the world. In this day and age, we are a global society. We're just one plane ride away from some deadly illness. We think of TB as a disease that affects other countries. The US is rather rich and that it's been a poor person's disease. If you have a disease that's airborne, no amount of money is going to save you from getting that disease. This is very much a disease that is part of our city. Living conditions are very cramped. And you see that in the morning rush hour. It's a perfect breeding ground to transmit TB. Healthcare workers in general are scared of getting TB. I have a feeling that I will become positive working at this clinic. So you don't think this is actually positive? I kind of think it is positive. When a PPD is positive, it means that you have the TB bacteria in your lungs. Mm-hmm. Have you known anybody that has had TB? No. Well, the first thing I need to do is examine you. Okay, I need to look inside your mouth, take a listen, and then we'll talk about what else we need to do around this. People are not willing to come forward to tell you that they have TB or that they think they may have TB. It's not easy to treat. There's tons of medications involved. Physicians, we see about 20 to 25 patients a day, and we potentially could expose all of our patients if one of us had TB. This is not a disease of the Chinese. It's not a disease of people from India or Mexico. As long as you are around anybody that has TB, you can actually get TB. If this continues, you will have a problem in the US. Tuberculosis has been with us for a very long time, and if there was a TB vaccine, you would save many, many lives. A vaccine would not only protect us as a community of healthcare workers, but it actually would protect the people that we serve, which means one day there would be no more TB.
I volunteered to work in a tuberculosis clinic in New York City in the early 90s. Working in that clinic, my tuberculin test converted from negative to positive. I was fortunate in that my TB infection didn't progress to TB disease. I'm Dr. Tom Frieden, Director of the Centers for Disease Control and Prevention. I've known of healthcare workers who got multi-drug resistant tuberculosis from working with tuberculosis patients. Here they were trying to help others, and they ended up getting infected. No healthcare worker should have to choose between their health and their work.
As doctors and even medical students, I think you're exposed to a big volume of sick patients. It's so hard to trace who has TB and who doesn't. You could say that almost everybody that you try to examine could potentially have TB.
Everywhere healthcare workers are suffering and they are frightened. There are so many cases of nurses and community health workers and even doctors getting affected. They are not just doing it as a job, a 9-to-5 job, 8 hours job, and they get a certain amount of money. They are doing it because they are here to help people.
Healthcare workers are part of the community. They provide the support to the community to get the services they need. And if healthcare workers are at risk, are getting sick, especially if that's preventable, we're not doing what we could and should do to protect and promote our community health.
We think of TB as a disease that affects other countries, that, tuberculosis can affect us. If you have a disease that's airborne, no amount of money is going to save you from getting that disease. As long as you breathe, as long as you're walking around and there are people around, anyone can actually get TB. Healthcare workers in general are scared of getting TB. Just because you are negative now doesn't mean that you won't actually become positive.
When any healthcare worker, a student or a faculty or a staff gets tuberculosis, it hits closer to home and it touches the heart. We cannot sit back and watch this deadly disease devour our colleagues.
If we can't protect our healthcare workers, then we can't run our healthcare system effectively. So it's important not only as a matter of human rights, but as a matter of basic protection and our ability to function as a society. Even with our best efforts, tuberculosis continues to kill more than 1 million people every year. And though we can treat it and cure it, a vaccine would be our greatest hope. We need to figure out new approaches to making a vaccine and new approaches to testing and implementing vaccine trials. The more progress we can make, the more lives we can save.